Great. Well, I think we'll get started. Thank you, everybody, for joining us this evening. My name is Chenza Cacciati, and I'm the Family Engagement Coordinator at Canuck Child and Family Services. Welcome to this evening's family education session. This evening's topic is medication education for parents with children and youth experiencing mental health issues. Our family education series, developed in partnership with our Family Advisory Committee, is intended to build on your capacity as caregivers to identify, understand, and respond to childhood and adolescent mental health distress. During tonight's session, you will learn about mental health in young people and the use of medications in supporting them in their mental health, an overview of psychotropic medications, including their risks and benefits, potential alternative interventions, and the parent or caregiver's role in medication management. There's a few housekeeping items before we get started. All your phone lines are muted and the cameras are turned off to ensure a clear connection throughout this session. We've set aside time at the end of this presentation to answer any questions that you may have. You can ask a question by selecting the Q&A icon and a window will appear to submit your questions. There is an anonymous feature if you would like to ask a question anonymously. Feel free to submit questions throughout the presentation so you don't forget when you have a question pop into your mind, and we'll make sure to answer those at the end of our session. And please note that we can only respond to general questions relating to tonight's presentation, as individual advice and consultation cannot be provided. We will try to respond to all of your questions to ensure we have time to respond to as many questions possible. If we have similar questions, we will group them together and answer them accordingly. At the end of the meeting, we will launch a poll to collect your feedback on our session. If you are having any technical difficulties, use the Q&A feature to report them. We have our tech support here to assist us in any mishaps that may occur. And we will be launching a poll now just to identify our audience. And again, we will launch a poll at the end of our presentation for your feedback and to support us in future presentations. So welcome, everyone. Thank you for joining us on this cold and snowy evening. I would like to welcome our presenters, Francine Zander and Feroz Tajdar. We are fortunate at Canuck to access the expertise of nurses in all of our programs. Francine has been a nurse for just over 40 years. 32 of those years has been in children's mental health, and just over 25 she has been with us at Canuck. Francine consults to our community mental health-based programs and works collaboratively with our psychiatrist. She also educates staff, clients, and works with families about mental health, medications, and other health-related topics. Feroz Tajdar is a registered nurse, and he has been a certified psychiatric and mental health nurse for just over 8 years, and he is also a clinical therapist in our Simcoe program. So welcome, Feroz and Francine, and guests, and we can commence with this evening's topic. Jay, if you can send the poll, and we can identify who our presenters are. But our presenters are welcome to get started.
Thank you. Feroz, did you want to get started with the...
Sorry, I'm having some camera issues. Let me see. I need luck. Okay.
Are you good? Can you see?
It's a bit finicky. It's turned on and off by itself. Let me see.
Are you able to see the slide presentation, Feroz?
Yeah, I'm able to see that.
So that's okay. You can just go with that and we'll see what happens in the meantime.
All right, okay. Yeah, without taking too much of the time troubleshooting that, welcome everybody to our medication education for parents with kids with mental challenges. Tonight's agenda is mental health in young people and the use of medication, overview of psychotropic medications, parents' role in medication management, and then parenting and mental health. Mental health in young people. Approximately 1 in 5 children and youth in Ontario has a mental health challenge. About 70% of mental health challenges have their onset in childhood or youth. That's why early identification and intervention is so critical and can lead to improved achievement in school and better health outcome in life. So this is what you're seeing on the slide here is some of the most common mental health struggle or challenges. It ranges from ADHD, anxiety disorders, mood disorders, eating disorders, autism spectrum disorder. All right. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is a developmental impairment of the brain's executive functions. People with ADHD have a hard time to sit still, pay attention, or make good decisions. ADHD is often begins in childhood. ADHD can cause a child to have trouble in school, at home, or with friends. ADHD is more common in males than in females. What ADHD is not, ADHD is not a behavior disorder. For example, if a kid is not listening or engaging in undesired behavior, that's not that this is that they have behavior issues. It's something else. So, and then we have ADHD is not a specific learning disability. If a kid has challenges in certain subjects, it doesn't mean that they have a learning challenges. Learning disability is assessed and screened through different ways, and usually like school psychologists or other individuals can diagnose that. There is no cure for ADHD, but different treatments can help improve a child's symptoms and behavior. Both adults and children can be diagnosed with ADHD. Anxiety in young people. Anxiety is part of the human condition. Worries and fears are a natural and adaptive part of childhood development and important for good coping and survival. Anxiety becomes a concern when it causes excessive distress, gets in the way of daily functioning, goals, or development. Anxiety disorders are the most common childhood onset psychiatric disorders. And I would like to say sometimes it's also misdiagnosed as well, because the child may be going through its own development, and sometimes it's easily missed at home or by or at school. Anxiety disorders in children up to 12 years old and adolescents 13 to 18 years old are associated with educational underachievement and co-occurring psychiatric condition, as well as functional impairment that can extend into adulthood. Depression. Depression is a mood disorder that makes a person sad, irritable, or hopeless for a long period of time. Depression can make it hard for a child to enjoy activities, perform well in school, and relate to their family, friends, and teachers. People often think of depression as an adult problem and not something that affects children, but children, especially teens, can suffer from depression too. What is ASD, or autism spectrum disorder? Autism spectrum disorder is a neurodevelopmental disorder characterized by deficit in social communication and social interaction and restricted repetitive patterns of behavior, interest, and activities. People with ASD may also have different ways of learning, moving, or paying attention. Researchers have consistently found more boys than girls with autism when estimating the condition's prevalence. It is reported through several studies that the co-occurrence of ASD and ADHD is in the range of 30 to 50%. So if a kid is struggling, let's say they're diagnosed with ASD, they're struggling at school with paying attention, sitting still, that would be something to be shared with the doctor to be screened for ADHD. Again, ADHD can also be left untreated, and that can cause a lot of challenges at school and at home.
Okay, so when we're looking at treating mental health, there are several types of treatments for mental health challenges. We can look at counseling or psychotherapy. We can look at prescription medications, and we can look at other complementary therapies and treatments. And often, more often than not, a combination of these are more effective than just using one alone to treat the illness. But we always recommend that you start with a visit to your primary care practitioner, your doctor, because you may need at one point to have their support in order to get prescription medications if that's required. Okay, so it's always a good idea because they can support you with assessments and recommendations. When considering medications, we talk of a group of medications called psychotropic medications that deal with treating mental health issues. There are 5 different classifications of these medications: anti-anxiety medications, antidepressant medications, antipsychotic medications, mood stabilizers, and stimulants. And we're going to talk a little bit about each of these areas. So what do you need to know about medications? So it's really important when you start considering medication to look at the risks and benefits. And these should be discussed with both you and your child before any treatment is being initiated. Medications do not cure mental illness, and that's really something you need to keep in mind. They are a tool, so they can be effective in managing symptoms, but they don't cure. So administration should be started always at the lowest dose in children, and the dose can be increased incrementally if it's well tolerated over the course of time. Adverse effects. Well, we know that sometimes people start taking medication and they do have side effect symptoms. However, we have to weigh and look at the risks and balances. So we have to look at the benefits or the risks. If it's something as minor as, it makes me have a little bit of nauseated stomach in the morning, but it helps me with all of my issues, you have to see which one is worth following through on. There are sometimes psychiatric effects, which are disinhibition, agitation, and worsening of symptoms. Those can be some of the side effects from a psychiatric lens. And from a physical lens, you're looking at possibly headaches, upset stomachs, or sleep problems. And this is generalized, okay? So we're not looking at a specific medication. This is just overall looking at all the medications. When we talk about ADHD medications, these are prescribed for both children and adult. And there are 2 different classifications of ADHD medication. There are stimulant medications, which are considered the first line of defense. And there are 2 family groups in that group of medications. One is amphetamines and one is the methylphenidate group. And these are the first line of defense for ADHD. Non-stimulant medications are prescribed for patients who do not tolerate or see benefit from the stimulant medications. So these non-stimulant medications, there are 3 different non-stimulants that are approved to treat ADHD, and they are called, there's atomoxetine, guanfacine, and clonidine. Now, these may also be prescribed alongside stimulant medications to improve or to, heighten the effects of stimulant medications for some people with ADHD. So this slide shows a little bit of the possible side effects associated with stimulant medication. So our little fellow in the center is showing you where in the body this may occur. So in the blue there, it talks about dizziness, drowsiness, fatigue, trouble sleeping, behavioral problems. We've got sweating, In the green, we've got the upset stomach, vomiting, diarrhea, loss of appetite, and weight loss. And then in the gray, muscle tics. Now, these are all possible. It doesn't mean that one individual is going to experience every single side effect, but these are just some that have been reported over the course of time. Some are things you could live with and others are not. So these are things to keep in mind. So medications for depression and anxiety. I know we talked about in the 5 groups or classifications of medications, we talked about anxiety medications and depression medications. I want to clarify, for long-term treatment of anxiety, usually the medications that are chosen are the antidepressant medications because they're better to use long-term. The group called anti-anxiety medications tend to be used for shorter treatments of intense anxiety issues. So more so related to if there was a scenario, for instance, like the death of a loved one or something where someone is having an extreme anxiety attack, they could use those anti-anxiety medications, but those are not usually prescribed for long-term use. The antidepressant medications fall under a couple of categories. We've got the SSRIs, which is the selective serotonin reuptake inhibitors. Those are the first line medications that are treating both depression and anxiety. They work on the same neurotransmitters, specifically this one, serotonin. And then the second and third line of defense are the serotonin norepinephrine reuptake inhibitors. So those work on both serotonin and norepinephrine, which are, again, neurotransmitters in the brain. And those would be the ones that would be chosen for long-term treatment of either depression or anxiety. Some of the common names you might see on the left side there: citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, and sertraline. You may have seen those. Those are generic names. Paxil falls under the paroxetine, so you may know them under a brand name, but those are some of the more common ones used with children and adolescents. I want to talk a little bit about the course of antidepressants. So you'll see on this little chart on the left side, the low and high, those would be the benefits, okay? And as you can see on the bottom line, it's days, weeks, and months. Now, our little red fellow there with the side effect profile, the red line, shows us that immediately when starting medications, you start to notice if there's going to be side effects. And generally, when people start taking any type of medication, whether it be anti-anxiety medication or, anti-sleep antidepressant medication or anti-anxiety medication or ADHD medication, any of those groups, you will notice that right away you may have some side effects. So some headaches, some nausea, some dizziness, and those side effects come right away. And it's usually because the body is going, hey, what's going on? What is this, right? And until the body adjusts to the medication, these side effects may be a little nuisance, but they do over the course of time dissipate and go away. With antidepressants, it takes about 2 to 3 weeks to see the benefit of a given dose, okay, or medication. So you're going to notice the side effects first and not so much the benefits. But over the course of time, the side effect profile does drop away and the benefit increases. What I also want to talk about here is with the antidepressant, I'm sure many people are concerned about putting their children on antidepressants because they've heard that the antidepressants carries a black box warning, which is the highest level of concern that the FDA, the Food and Drug Association, puts on any medication. And that's around the increased risk for suicide while taking these medications. The issue with that is that, as I said, the side effects happen right away, but the benefits don't. happen until a couple of weeks later. So if an individual is suffering from depression, they're really feeling terrible. They can't seem to get themselves up in the morning. They can't get themselves out of bed. They find nothing in life is pleasurable. And then they start having all these side effects. Life isn't going to feel so great. And if they've already been suicidal or having thoughts of suicide, they don't feel great. The benefits start in, and the first thing that comes back is their energy level. So they're still feeling crappy, they're still feeling these thoughts of suicide, but now they have energy to follow through on them. So the first 3 weeks is where we say there has to be a strong support network surrounding your youth or your individual who's starting on an antidepressant. Because if we can get them past that point where they start to feel the benefits even more, then those thoughts of suicide are going to dissipate and they're going to be able to get through that. So that's why they've put the black box warning, is to make people aware that the antidepressants don't cause the suicide, but they do allow the person to feel more energy to be able to follow through before they're feeling the complete benefits. So we want them to get through that hump. And we just want you to know that it's important to make sure that you have a good safety network, that you're working closely with your prescriber and your therapist, and that the family is a really good support network for the youth or the individual. Some of the possible side effects for these antidepressant medications, again, sweating seems to be the most common thing, upset stomach, diarrhea, and constipation, headaches, dizziness, dry mouth, blurred vision, trouble sleeping and feeling tired, and difficulty urinating and sexual problems. Okay, so these are generalized, and again, not everybody experiences all of them. So the research evidence for treatment effectiveness is that children between the age of 7 and 17 with anxiety, some or much anxiety, show clinical improvement about after 12 weeks. And that is, if you look at just with medication, 55% benefit from the medication. When you look at just treatment therapy, CBT, which is cognitive behavioral therapy, there's about a 60% benefit. And then when you look at a combination of both the SSRI and the CBT, it jumps up to 81% of effectiveness. So we know that joining these two treatment solutions is a much better combination than either of them on their own. Okay.
All right. Thanks, Francine.
No problem.
I hope my camera
Feroz.
works this time, maybe because it's because of the weather. So I'm going to be talking about autism spectrum disorders, some of the medication that's approved for it. Again, medications do not cure autism itself. The potential benefits and risk of medication therapy for children with ASD must be assessed on a case-by-case basis. Only 2 medications are approved by the FDA specifically for irritability in children with ASD. So that's risperidone and aripiprazole. Both these medications are from second-generation antipsychotic. Medications, when it comes to ASD and then treating them with medication, it's a little bit different than treating anxiety and depression. It's looking at the symptoms that is actually interfering in this kid's life, whether at school, at home, and then based on that, one of these medications are chosen to treat that for, as I mentioned, like irritability. If there is aggression, then that would be another piece to that would play a role in terms of managing it through medication. And it's also important to like periodically reevaluate the need for continued treatment. If irritability is subsided, if there is no aggression, then it may be time to kind of like either look at the, with your prescriber to see what are the other options. Is there an option to maybe lower it a little bit or whatever other option may be available. So it's always like on a case-by-case basis and only treating a specific symptoms of ASD. It's because children with ASD are more sensitive to medications and more likely to have side effects than children without ASD. So that's why it's very used calculatively and on an as-needed basis. All right, so antipsychotic medications and then some of the possible side effects. So we have some side effects in the blue, which is dizziness, drowsiness, blurred vision. I would say, depending on which medication is that is from the second generation antipsychotic, it would have a side effect maybe much more common than the other. For example, risperidone, you may see dizziness or drowsiness compared to, for example, Abilify. So, but these are some of the most common side effects. So in the blue, dizziness, drowsiness, blurred vision, dry mouth, aggression and agitation, anxiety, difficulty concentrating. And then there is also like breast discharge. That's usually when it's taken for a long time. Usually when that happens, there is a hormone that increases, which we call it prolactin, that leads to breast discharge. It doesn't happen right away, but someone needs to be on those medication for a long time. And then there is also an issue of constipation, weight gain, nausea, vomiting, and then there is like tremors, shaking, stiffness, abnormal movements, changes with urination, sexual problems, menstrual problems. Again, it's just case by case. No one will have all of these side effects. There will be like some side effects. Usually, those side effects will subside as the body adjusts to it. But it's important to keep be on the lookup for if there is any unusual side effects that you're noticing. Then that would be to consult with your prescriber to manage that right away, because if a teen or a kid is continue to have these side effects, then it may deter them from taking those medication because that side effect is so unpleasant. Okay, so what do I need to know about medication and mental illness? When discussing the use of psychiatric medication with your doctor, open communication helps to find the right psychiatric medications for your child and youth. Medications will not produce the same effect in all children and youth. Changes in dosages or psychiatric medications are not unusual. You may see your doctor or psychiatrist may quickly change from one medication to another. It's usually try to find a combination or a medication that is best suited for those symptoms that are being treated with less side effects. So that's like ideally what is looked for. All medication, including herbal supplements and over-the-counter medication, as well as other forms of treatment, should be discussed with your doctor. If these treatments are used in combination with psychiatric medications, there may be drug interactions or side effects that may be dangerous for your child. So what can you ask the prescriber? So ask your doctor for clarification on anything you don't understand. Communication supports shared decision-making and improves treatment outcomes. I just wanted to emphasize it's always important to have your child to attend those appointments because the doctor will be going over the medication, what's the name of the medication, and so on and so forth. It makes also your job a lot easier. So you're not taking that role as well of explaining the medication to your son or daughter. So question that you can ask, what is the name of the medication? What are the symptoms this medication is supposed to treat? What if my child cannot swallow pills? Are there any other options? How and when should my child take it? What should I do if my child misses a dose? What are some of the common side effects of this medication? What should I do if side effects happen? How long will it take for the medication to start working? Is there any reason to stop taking the medication? When should we see you again? Is there information handout for me to take home? Some doctors may have some handouts to give it to you, but usually the pharmacist will have access to those handouts, and those handouts are very helpful, and they're free to access. So I would encourage anyone who's their son or daughter on medication to ask the pharmacist to give you a handout. It's always helpful. Ask the pharmacist. It's good to work with one pharmacy and the pharmacist who knows your child and the medications they take, how they react to the medications, and if they could be at risk of any drug interactions. Some of the questions you can ask your pharmacist: how, with or without, and when, number of times or best time of day should I take the medication? How long will it take the medication to work? What are common side effects of this medication? When do they happen? Tell me about any serious side effect that can happen and what to do if they happen. Is there any reason my child should stop taking this medication? Should my child avoid any food or drink? Does my child drug plan cover this medication? And how much does it cost? Important things to remember: medications of any kind prescribed over the counter or herbal supplements should never be mixed without consulting the doctor. Medication should never be borrowed from another person. Other health professionals who may prescribe a drug, such as a dentist or other medical specialists, should be told that the person is taking a specific medication in dosages. Some drugs, although safe when taken alone, can cause severe, dangerous side effects if taken with other drugs or alcohol. All right, so what can help? Adequate sleep, nutritious food, making sure meals are eaten, so breakfast, lunch, dinner, and snacks. Think of food as a medicine. It helps with the growth and development. Kids and teen body continues to develop, and their brain is continuing to develop. So those eating, not skipping their meals, would be really, really helpful. And also like engaging in regular physical activity or something, or pleasurable physical activity, whatever that may be, so that to help the body to move around. Turning to Francine.
Yes, thank you. Thank you, Feroz. Now let's talk about parenting and mental health. So we all know that parenting is hard work on its own, and parenting a child with mental health issues is so much harder. And you're always, always on the go with that. You're almost certainly putting out more effort than any other parent is in a normal situation. So we know that, you feel like you're giving it all, and yet your child may still be at risk, struggling, or making less progress than any other peer they have at school. This raises a crucial question. So how can you keep going without becoming exhausted? That's a really important question that you should be asking yourself. You guys have probably worked all day or taken care of the kids, or when the kids got home, you made them dinner, and now you're sitting here learning some more and doing as much as you possibly can. And then you need to find a moment for yourself. So you need to avoid parent burnout. It requires real effort and conscious effort. So experts note that consistent self-care, establishing a strong support network for yourself, and having a trustworthy therapeutic team for your child is some way to avoid this parenting burnout hole. Okay. And one of those things is self-care. So what does that mean? Self-care means that you have to look at how to keep yourself healthy and well so that you can do your job to help you take care of others, and so that you can do the things that you need to do and that you want to accomplish in a day. Parents want to be the best they can for their child, and especially if their child is struggling with mental health issues. It's important for parents to address their personal needs in order to do so. And we all know one thing that we see all the time is that our actions speak louder than words, and our children see what we are doing. And so if we're not taking care of ourselves, they see that, and they then don't take care of themselves. So the best lesson they can learn is to see you taking care of yourself as well. So areas of self-care are to consider your physical well-being, your psychological well-being, your emotional well-being, your spiritual well-being, your personal well-being, and your professional well-being. So what does that mean? Well, you look at all of those areas, think about what's important in all of those areas, and make time for those things so that you can balance everything. Okay, so if physically you feel you need to take a walk every morning, then you need to do that to keep yourself healthy. And if going to work gives you that away time for yourself to regenerate and to feel productive someplace, then you need to go to work. You need to find some way to make sure that work is a place that you can go and you can do that and feel competent and feel that you've recharged. If spiritual is important to you, then find a way to find that time in the week to be able to do some spiritual stuff for yourself, and so on with all of these areas. So it's really important to take time for yourself so that you can continue to be great parents. That's really important. So we want to thank you for joining us. And I think, Chenza, you are going to take
Yes.
some polls.
I am going
So
to.
should I
We're going
stop
to take
sharing the screen?
You know what? We'll take some polls after we have some questions. We did have a question if these slides are available. A recording will be on our website at www.canark.on.ca. Probably by the end of next week. So you are more than welcome to view recording of this presentation and previous presentations that we have had in the past. So thank you so much for this presentation. I have a few takeaways, and I welcome all of our attendees to use the Q&A feature on the top of the screen to submit your questions to our presenters. But I really, my takeaways was I really appreciated, Rose, when you mentioned to take your child with you to the doctor. I think it takes a lot of the burden off parents and caregivers to be that sole person responsible for sharing the information about the medication. To use your doctor as part of your support network, I think is really, really important. I really appreciated the holistic approach to mental wellness in children, including exercise and good diet and good sleep. I think that that's really important along with medication. And thank you for the parenting advice. For families, I think that I've read studies that families of children with complex needs have the same hormones as soldiers in active combat. So thank you for respecting that families do go through a lot in parenting children who have special exceptional needs and require a bit of extra care. So thank you for that. I'm going to check our Q&A to see if we have any questions. One thing that we hear a lot from our parents is that physicians are often reluctant to prescribe psychotropic medications because they're not comfortable with the SSRIs, et cetera. Is there a plan B for families who have a family physician who might not be comfortable or have the knowledge in prescribing these types of medications?
So I'm happy to jump in there to start with. The thing is if your family physician is not comfortable prescribing, you can always ask your family physician to refer you to a pediatrician or to a psychiatrist, Now, psychiatrists are hard to come by these days, especially pediatric psychiatrists. However, there are a lot of pediatricians who specialize in areas such as ADHD or ASD, and they're more familiar with medications that are used to treat those concerns. So you might ask them to refer you. And if not, ask them to seek out clarity with other specialists, and that may be helpful. I don't know, Feroz, do you have anything else to add?
No, I think you covered it all.
Excellent. Also, parents also report that teachers, as particularly if a child is a little hyper, a little behavioral, that a lot of times teachers really kind of encourage families to put their kids on medication. And that might not be something that the family doctor agrees with, or the parents are comfortable with, or if a professional does an assessment, they don't feel the child needs medication, he's perhaps just a hyper behavioral type child. What advice would you give to parents in dealing with professionals who are not professionals in the field of mental health in addressing that?
Rose, do you want to take that one?
Yeah, I can take that one. Yeah, that's I think one of the most common that I see it in my area as well. That I hear from parents that the teacher may be like seeing something, the kid is like hyper and cannot sit still and things like that, cannot pay attention. We have to look at it again. I may probably go into a longer answer, but I think it's important to do that, because kids naturally, like, they would be like, that's part of the development. There would be like some energy in it compared to an adult. You'll be like, you wouldn't expect a child to be like sitting for hours in one place. Even that would be hard for an adult. But if it gets in the way of academic achievement, like they're constantly moving and they cannot pay attention, then that would be something to like bring it up to the physician, and the physician does the screening, that the questionnaire that needs to be completed by a teacher and then at home, and if there is anyone else involved. But in terms of teachers recommending that, I think it would be to get that information, and then, because that's an important observation, because at the end of the day, I also see teachers, they want the best for that kid to have good grades and well behave in class and not get in trouble, because sometimes it also causes other issues. If they have too much energy, they may become hands-on and things like that if we leave it untreated. But there is a balance. So if they see that, take that information, share it with your family doctor, and then let the family doctor, or if there is a pediatrician or a child who needs psychiatrist, decide on what to do next.
Excellent. Francine, I've worked with some families with you when you have supported them with their their children with mental wellness. And I think you'd be very good in answering this question, although it's not directly about medication, but I understand this family's need for support here is, where would a parent start in trying to build their support network? Definitely feel alone in parenting a child with extreme and diverse needs.
So very good question. And, when you're dealing with a child and there's something going on and you're not quite sure, and there's not been any assessment, I mean, it's always great to reach out to your family physician to start with, because they can do some baseline screeners, as Feroz was mentioning. The other thing is you can reach out to places such as Kinark, or, look in your local areas to see what kind of therapy or support services are available. The other thing is look right directly around you, your immediate family, to see who can support you. I know, though, that sometimes as parents, you feel quite judged by your extended families, perhaps. And so some people try to steer away from, saying, I think there's something wrong with my kid, to extended family members, because they feel then judged. However, I'm sure if you look around, it doesn't have to be immediate family, but if there's at least one person that can be there to support you as a parent, to just be kind of your cheerleader to help you move along where you need to go, because sometimes it can feel quite overwhelming. But definitely you have some supports. Some people who are into a church or a spiritual group can look to their spiritual group for support. So there are people around you that have been around you for a long time, and you can start there and then move forward. But your family physician definitely is one of them. Sometimes, as Feroz mentioned, the school teachers are really out there they think, they want to help the children to accomplish, to be successful. Sometimes the teachers can help you and sort of steer you into an area. Perhaps, the schools do have psychologists who can do psychological assessments at times. So having, your teacher with the school group sort of look at options or supports might be there as well. So those are places you can start.
Yes, and I know that parent support groups, Parents for Children's Mental Health, Autism Ontario have some great support groups. I'm going to fully disclose I'm the parent of an adult now with autism and some significant mental health challenges. And I find that other families, sometimes it helps to write a list. I know when it gets so hard as a parent, you're feeling quite isolated and down. So just jot down those people that are close to you, and you can expand your network from there for sure. Another question that we have that's interesting, that I've heard this before as well, and I think she's looking for some advice how to move forward, but my child has ADHD. The teacher says that with or without the medication, they don't seem to make a difference. He still won't work. He doesn't respond, will not follow instructions. Is this time to stop the medication? Can you support with next steps?
I can take, if that's okay with you. I think that if I understood the question correctly, it sounded like the teacher wanted okay, these medication or any other approach would not work with this kid. Or
no,
this
they're
kid
saying
is already...
that the child is on medication and they don't see a difference in the child's behavior.
Okay, then
they stop?
Then that's a good observation from the teacher, because the teacher is seeing the child every day, and they're not seeing improvement. As I said, this is a good observation. Then that needs to be brought up to the physician, that this is what the teacher is noticing. It can be managed through different ways, either to titrate or optimize the medication a little bit more, because usually it started at a very small dose to assess for side effects and tolerability, and then it increased based on that, and then keep it at that level when we see there is some of the symptoms are improved. But if it reached to a point where it's keep increasing, and then there is no significant improvement, then there is another medication tried. We covered in presentation, it's not unusual to see one medication is quickly changes to another one, or doses are increased and making significant changes to it. It's just because we're all different. Our biochemistry is different, so we all respond to medication differently. And that's why the right combination medication is sometimes unfortunately through trials and errors until finding the right combination of medication. So in this situation, I think bringing the question or the concern back to the physician, and then having them to look what they can do. I know I don't have a lot of information about this specific case. If they have already tried to go to the highest dose and they're not seeing the benefit, then there is a different way to manage that. But again, the physician is going to be the best person to be consulted on to see what's next step.
And monitor and assess. Francine,
I'll just add something there for Chenza. I'll just say sometimes, when a client is diagnosed, or they give them a diagnosis of something and they try a medication, they are trying, and this happens a lot with ADHD medications, because ADHD medications are in and out the same day, so they're in quickly. So sometimes physicians will say, oh, it's ADHD, prescribe ADHD medications, try them. And if there's no benefit, then sometimes it's a misdiagnosis. Maybe there's something else going on along with the ADHD or instead of the ADHD. So there may be an anxiety, which is also interfering. And so there may be comorbid, or what we call comorbid, which is two things happening at the same time. So it's not to say that, the medication's not helping in a little bit, but it may be that there's something else that's a bigger problem. So
Thank you.
I agree with Feroz, speak to the doctor. Yeah.
Yeah, thank you for that. And I think pharmacists are good sources of information too for families whose children are on medication, if I'm not mistaken.
Yep.
Absolutely.
Absolutely.
We have not so much a question, but a comment, which I think really does support our earlier conversation with families creating their own support networks and really connecting with other families. And I think this is a really important comment because I've kind of lived through it myself. But the comment is that as someone who is the primary support person for someone with mental health illness, my experience is that the choice of medication seems to be hit or miss, like you just addressed, as to whether it's effective or not. And then further, it's really important to understand that weaning one off meds to start another can be a very painful process for the patient and their family.
And that's true. And I would like to add to that weaning off and titrating up that Feroz was talking about are extremely important to do with the guidance of your prescriber. Don't just stop medication cold turkey. That can cause serious undesired effects and problems. So really important to make sure you're doing that with the consultation of your physician.
Excellent. Thank you so much. I'm going to. Jay, would you be able to copy and paste the questions I haven't addressed? I'm having trouble with my Q&A feature here. I think I've got it. Thank you, Jay. I appreciate that. My son has ADHD, taking Vyvanse, but the medication does not seem to last long enough during the day. Doctor says we should increase his dosage, but he's also very small with slow growth. So is it good to give a lower dose during the day so it would help with his behavior after school? I think perhaps you might need more information. But
I just want to add, I'll say this because I think it's really important for people to understand. You may have a small child with a need for a higher dose. And when we talk about psychotropic medications, we have to understand, I mentioned earlier that these medications work on the neurotransmitters in the brain. So it's misfiring in the brain with the ADHD. And so it's addressing those neurotransmitters. So it's not always about how heavy the person is or what sex they are or how old they are. It's about their neurotransmitters. And we can't, there's no blood work to be able to monitor how much or how little of a neurotransmitter is in the brain. And so that's why we talk about trial and error and just trying these medications. So you may have a very tiny little person who requires a larger dose than maybe a larger person, but it's just because of their neurotransmitters in their brain. And so it is important to understand that if the medication is not working long enough, then you do have to go back to your prescriber and talk about what are other options. Is it another medication that works longer? Because some of these ADHD medications work for a certain period of time, whereas others work for a longer period of time. So they will cover a longer period. So that may be the need, is to discuss that and look at the options. Do we increase the dose or do we change to a different medication in that family group?
Okay, thank you very much. That's very helpful information. We have a participant an attendee who is wondering if there's long-term long-term effects of use of antidepressants. Are there any negatives for long-term use or length of time to take them? This family member has been using it for about 1.5 years with her child, and great results so far. So just concerned for longer-term side effects, perhaps. Negative mostly.
Yep, I can try to answer this question.
Thanks.
So when we look at treating anxiety, depression, ASD, is the risk of treating and versus not treating it, right? So and this is where the decision is made, like, okay, let's try this medication, and then for how long we are going to be prescribing this medication and treating that symptom. Regular follow-ups with your family doctor or the psychiatrist. This is why it's helpful to have those. There is sometime blood work done to make sure that the medication is not causing any changes into the in blood. As far as I'm aware, I've seen kids be on these medication for a year, as long as 3, 4, 5, 6 years. So, and not seen any significant side effect. So I think I go back to the risk and benefit of that. So not treating it is going to be very challenging for the family and also for functioning of this youth.
I'd like to add too, Feroz, as I mentioned in one of my previous slides, there was the research around the use of medication along with therapy. And I think it's really important that to understand, as we've mentioned, I think Feroz mentioned in one of his slides that mental health is not curable. It's treatable, but not curable. And so how do we treat? And the best way to treat is to provide people with strategies to manage their emotions and their feelings. And so the medication is a tool to help them get there, but they have to do the work. And so the therapy, the CBT or the DBT that they can do with the therapist will give them long-standing strategies and effectiveness to be able to carry that through. So over the course of time, if they do therapy and learn ways to manage their own inner emotions and thoughts, then they may not have to be on medication as long as some others that are not being treated with therapy. So if you're doing it in combination, it gives you long, standing strategies that you have in your back pocket that you can pull out anytime, kind of thing. And so
Right.
it's a good thing to do both.
Excellent. And best to have a good relationship with your prescribing physician so we can really monitor that. Now, I have a question that I think is a lot of parents feel this way. So you are not alone, but a lot of time I feel guilty giving him medication, even though it is improving his behavior, because I feel like I'm not letting him be himself when on medication. I feel like I'm controlling him, but without it, his behavior is off.
So I've heard this concern many, many times. And I think, Feroz talked about how you look at the risks and benefits and the, long-term effects on a child. We want to measure the child's life and successes. And if we can provide the child as young as 6, 7, even younger, with some successes, they can measure themselves in successes and not in, failures. And so if we can help them by using some medication to get them to be successful, they're going to enjoy their life much better. They're going to learn much better, and they're going to be able to look to the future to be able to be successful and have a dream to complete something and to be successful in life. And so I think I talked about family as being supportive to you and or judgmental. And so we do find that sometimes family members might go, oh, why are you putting your child on medication? That's terrible. Do you know how young they are, how bad that is for you? And then you can look at yourself and go, but I also know how badly they're struggling. And if I if I can provide them with some form of successes in their life and give them some good and help them, then I know that I'm doing my job as a parent to be there to help them. And so if, it's kind of like if you had food on your table and it was either you or your child that's going to eat, you're going to let your child eat. You're not going to feed yourself before your child. And so you have to think of it that way. What's the best thing you can do for your child? And if the experts are telling you, and you've done all the assessments and all the work that you need to do, and the experts are telling you that these are your options, educate yourself, ask the questions, and then make an educated decision for your child. And you won't have anything to regret.
Thank you, Francine. I think, I think if your child had a physical ailment or diabetes where they would be insulin dependent, I think there's less reluctance to use medication. So this is universal. I think all parents feel a little guilty considering medications,
Absolutely.
but thank you for that wonderful explanation. The questions are coming in and they're fabulous questions, and we do have about 25 minutes, so please keep them coming. We'll stay here for as long as they're answered, but is there an age too young to start medication for anxiety? Is it usually long-term, or can it stop and start like ADHD medications?
Do you want to take this, Feroz?
Yeah, I'm gonna give it a try. So I've seen in literature, not in my direct practice, they've been usually like 8, 9, and all the way to 17 and 18-year-old, but there are literature saying as young as 6 years old. That some of these medication can be tried, and again, it's on a very small dose, and risk and benefit is mentioned or kind of assessed on a case-by-case basis. Yes, it's common to for the prescriber to prescribe this medication and then see that now the symptoms are improving or improved, and then slowly kind of adjust it, or if there is a need for it to be tapered off. As Francine mentioned, that there is CBT already underway, DBT, or any other kind of therapies that are already with the medication, then maybe there is a time to kind of and given that there is a long-term stability, then I've seen in my practice that the medications are slowly tapered off, and to see how things are. And there's also the situation where medications are reintroduced. There's nothing wrong with that. But again, this is done with the consultation with your prescriber, rather than you do it yourself, because these medications are very, like I would say, specialized, and kids with their young body and brain, they're very sensitive to these medications. So one thing I want to caution: anything you do in terms of medication start and stop, that should be done with the consultation with your prescriber.
Thank you, Feroz, for that. Another question: does puberty affect SSRI treatment or dosage? Especially, I think this question is from a parent of a daughter, worried that if it will impact menstruation or hormones for boys, I'm assuming around the age of 11, 12, when they're going through puberty. Does the SSRI medication affect or dosage affect any development in that regard?
I've not read that it's affected development, although there is some side effect profiles that it may affect sexual like feelings. So, it may affect their libido as far as sexual feelings. And as far as the SSRIs go, it doesn't affect the hormones that I'm aware of. And I've not seen an issue in my practice where there have been problems with individuals being on SSRIs and having their puberty being affected. That having been said, I would say the reverse is true, where it's hard to tell, is it the medication, or is it the hormones that are causing the anxiety to go up or the depression to go up and down? So puberty can exacerbate those feelings of depression because the hormone levels are all over the place, but the medication isn't what's doing that. So
Thank you for that, Francine. Now, there's an interesting question. I'm going to address it, but let you answer it. Is there any connection between medications that have been beneficial for a parent? Would they same medications be effective for their child? It might be because we're thinking genetics, perhaps.
Yep.
One of the parents has been diagnosed as bipolar, and the son diagnosed with ADHD. We're finding medications that are not working. Would this using the same medication that's effective for the parent be beneficial for the child?
I can try to answer this question. I think we would like to have it thoroughly diagnosed before we get to a point where now this is it's very clear that this is bipolar. Now I do want to say diagnosing bipolar disorder in kids, in teens, is an area of hesitancy for a lot of specialists, because there is a lot of hormonal changes, there is a lot of growth happening, there are some natural things that's happening that it may not look pathological, or may not look like this behavior needs medication. Again, when it gets to a point where it causes impairment, then that's the time. So I would say, like, assessing that first, and then if it's got like, let's say if this was like true that we're noticing some mood disorder, then I think that the parent can bring up that they are on this medication, whether there is that this medication will be beneficial. I've seen in my practice that sometime through a lot of trials and errors, and then when we see that a parent is diagnosed with anxiety or depression, and then the kid also meets criteria for that, and then they need medication after consulting with their prescriber, then I've seen the same medication is prescribed, but not necessarily the same dose prescribed, and there is beneficial, like you mentioned, Shanza, there is the biochemistry of similarity there.
Yes.
But again, I would like let's first like thoroughly assess it before trying any medication. And again, this is done with consultation with the specialist.
And I think that's the message. Let's just always refer to the specialist prescribing the medications, right, to make those decisions. This is a really interesting question, and I think some that a lot of families might wonder about. Is real life practice at community groups or programs or sports to help kids with anxiety work as well as like a physical therapy program in a confined environment? So a group session to support anxiety, or would just playing on any community sports group be as effective?
So physical activity, we know that it releases certain endorphins, certain chemicals in the brain, and those chemicals help you feel better, help you feel elated and up. So it empowers you, and it feels you invigorate, makes you feel invigorated. And so that's why we know that people who struggle with depression and anxiety, if they do put physical activity into their a routine, it helps improve their overall feeling of well-being. And so that's why one of the things that is always strongly encouraged is a good physical activity, whether that's in a group setting, or whether that's just in a sports team, or whether that's just going out and jogging on your own. Any of those things are good. So I don't know if that answers that question. Usually I would just say, or add to that, is that if you're doing it with a group, you tend to want to do it more often. If you're doing it by yourself, there may not be that stick power, that, desire to do it. You can go, I'm not going to do it today. But if you're with a group, sometimes it's more motivating.
Yeah, and I think if it's been recommended to a family too, that a group therapy type environment would be beneficial. I think perhaps if we can manage both, to do both, so the child gets physical activity
Absolutely.
and gets the benefit of a group program as well. I think this would be really, I'm not going to read the whole question because I kind of think where I understand where they're going. Consent. This person has a 11-year-old that is when the child was 11, the medication was working. When the child turned 15, decided they no longer want to take the medication. How would you support a parent in that? And can you go into a little bit about consent? I think would be an interesting, not too much. We've got 15 minutes, but it might be interesting.
Yeah, as far as consent goes, I think that's why we encourage you to have the child participate in doctor's appointments from the get-go and be listening and have a voice, learn to have a voice in the conversation and educate themselves along the way. I'm not sure what medication they're talking about, but more often than not, when a child is diagnosed with ADHD and they're put on ADHD medications in their younger age, we usually, when they get to the adolescent stage where they're in high school, it's not uncommon for a lot of those kids to say, hey, I don't need these meds anymore. I can do this on my own. And I think what is really important to do at that point in time is to have a good conversation with your child and allow your child to bring up those thoughts with the prescriber as well, and to encourage them to have a voice in that conversation. Because really, the point of consent is at any point. If a child says, I'm not taking that, we're not going to sit on them, open their mouth and shove the meds in their mouth. You can't do that. It has to be a collaborative, joint thing. I mean, sure, as a parent, you want to encourage them to do it. And you can, some parents will bribe them and say, I'll get you this if you take the medication, just try it. But what we want to do is say, hey, listen, we want to help you. And this medication might help you. You might make friends. You might be able to have some successes in your life. And we want you to be part of this decision. And so why don't we together try this and look and see if it makes sense, if it works. So if they get to a point where as an adolescent, they start having questions about it, these are the times where we encourage them to have a voice to speak to their prescriber. So I think it's a healthy thing because they're living with the condition and they're going to have this condition their lifelong. And so they need to learn how to voice their opinions and how to be able to properly manage their medication.
Thank you, France. If you want to add, Rose, that'd be wonderful.
Yeah, I think sometimes also when a kid is refusing, sometimes it's not about the medication per se. It's about something else. Is it side effect? Is it it could be a wide variety of things that as Francine mentioned, I think starting that kind of a conversation from a supportive lens, I think really open up kind of that door of kind of working together. Yeah, consent is a tricky kind of situation, and it's like as Francine mentioned, I mean, there's also the legal way of, but then it's becoming like forceful, which is anything that becomes forceful, especially with kids and teens, is going to become like problematic. But I think that's like having those conversations, like first starting, what's the reason they're refusing it? Is it side effect? Is it the taste? Is it like the sensory piece attached to it? Or really maybe they have a legitimate kind of reasoning that they wanted to go off of it and then see if they can manage with a medication. So there's a lot of reasons for that.
Great, thank you, Froze. And you can tell the quality of a good presentation when there's a gazillion questions. We still have questions coming in. We do have about 10 more minutes, so we're going to take advantage of the time. And I'm going to try to reword this a little bit, but women do go through challenges on a monthly basis, and medications can have an adverse effect for a few days. that makes the medication less effective because there's hormone stuff going on. Is there much known about this? Is there a lot of research done on how SSRIs particularly affect women?
That's a very good question. And I don't have any research available or that I'm aware of at this point in time. I know that working with adolescents for as many years as I have, that, during puberty especially, it's very unpredictable. Emotions, feelings, thoughts are very unpredictable. And it usually is more difficult for these adolescents until they hit their, about 18, 19, where their periods are more regulated. That's where you're going to have all these hormonal swings, right? These ups and downs so much. The medications, to the best of my experience anyway, that I'm aware of, if they're working, they're going to continue to work. There may be an increase in PMS, so premenstrual syndrome, where people are a little more agitated, a little bit more irritable. But we don't know, is that the medication or is that just that individual and how their hormones are out of balance, right? But in my experience, I think the medications, if it's working, tends to work just as it would for anyone or that person, whether they're on their periods or not, or whether they're going through their flow. And I think it's more around, understanding that individual and them understanding their cycle, getting to know themselves. Because I think for a young woman, that is a big thing. It's really important for them to understand what their being, their hormonal balance is all about. So the more they get to know themselves, then they can figure that out. And if there are issues, they can bring that forward to their prescriber and have those conversations, because maybe there's another piece to it. There may be an imbalance, like a hormonal imbalance or something else that's also on top of their issues.
Excellent. And I'm going to try to generalize this question because I have heard about this and I've dealt with it in my own family, but a family has 2 children. Say they're in situations where they're addressing the needs of the child that has more needs, right? That is in for some challenges. This child hears everybody complaining about him. And it confirms to him that there's definitely something wrong with him. How can a parent support this child?
You want to take that one for us, or do you want me to try?
Yeah, I'm going to try, and then you can feel free to jump in. Yeah,
Sure.
that's an interesting dynamic, and especially when a kid is now noticing that in the environment, it can lead to a lot of challenges for this kid in order to have his or her need met, whatever that may look like. Becoming aggressive or engaging in undesired behavior. I think it's whatever the concern is, I think it has to be dealt in a way that it involves the kid without being judgmental towards it. But I'm not saying that the environment is like it's abusive, but maybe because there is so much tension and everyone is kind of don't know how to manage that, so that the emotion is starting to get in the way, and then try to kind of show it in a way so that the other person is to blame for, is actually kind of finding a way to kind of manage all that tension with the help of an external person, a therapist or a family worker. I think those kind of dynamics is going to be detrimental for this kid, and there's going to be a lot of acting out. It may lead to depression, anxiety, and and even demoralized. So it's like I'm glad they're noticing that this is what's happening. I think it's a time to kind of, if you guys can manage it by yourself, that's great in a way that's helpful and non-judgmental, depending on how old the kid is. But I think there is a room to get help from someone to
Yeah.
intervene in terms of family work.
Yeah, we used to.
And if I can add,
Yes, absolutely,
sorry,
Francine.
I just want to add, like, I think I love what Feroz has said and about the non-judgmental. And I want to just add too, if it's getting to that point where your child is noticing and feeling that pressure, I also feel that the parents are probably feeling that pressure on themselves. And so I think this is a time where you stand back as a couple or as an individual, if you're a single parent, and go, okay, what's going on with me first? How am I feeling about this? Because if we check with ourselves, often they're reading our emotions. And so we need to make sure that, as Feroz said, that we're not being judgmental and we're not displaying that. And the other thing I just want to add is, when you think of, if you've got two children, think of it, you have a boy, you have a girl, they're both separate. They're one boy, one girl, they're different. Even if they're two girls or two boys, they're different people. And you can't expect them to be the same. They're going to be different. And that doesn't mean right or wrong. They're just different individuals, and they may need to be addressed in a different way or accepted in a different way, and they see things from a different perspective. And so I think is to have the conversation, go easy on yourself, and remember that you are the barometer for your family. And if you can just keep yourself grounded, keep yourself well, you can manage it and you can find the way through it.
Yeah, I think a lot of these questions really do highlight the challenges of having a child with some needs and exceptionalities and some mental health challenges, perhaps, or a developmental challenge. It's tough. It's tough being a parent. And also there are sibling workshops through Learning Disabilities Association. Different associations have workshops for siblings, how they can be more compassionate and kind to their sibling who might be struggling as well. We have one last question, and I think it's a great one to end, and I'm not sure if you can answer it, but does ADHD medication help with stealing and lying? What could help?
Oh boy, that's a big one. Feroz, did you want to take that one?
So yeah, I can jump in. I think it's a great question because I'm gonna probably go a little bit back. Not treating ADHD can have a lot of detrimental effect: underachievement at school, getting in conflict with teachers, with peers, conflict at home, and then later in life, contact with the law, and then now, stealing, drug use to self-medicate the condition that was not treated early on in life. Now, I know so I just wanted to say the relationship of ODD to ADHD, opposition defiant disorder, sometime on a more extreme level. If it's not treated, then you have conduct disorder. I'm not going to get into it. What's coming after conduct disorder is different. But I think the most important thing is when ADHD is treated, we see less of an issue with ODD behavior, because ADHD is getting in the way, that increases conflict at home. The kid is not listening, running around, and there's a lot, and the kid feels like parents are depending on how old they are, on their back. So treating the ADHD once they're diagnosed, through medication and also through behavior management, some therapies, so there is less room for kind of these issues coming later in life. So I would say maybe ADHD is undertreated if the kid is engaging in such behavior. There is usually a function of that. Yeah. But that's what I wanted to kind of mention, the relationship of those two, and then seeing those negative behaviors. Usually, if we treat the primary issues, we may less have oppositionality, because if you tell the kid if they're undertreated with ADHD, the sky is blue and they're saying gray, then that's going to be that kind of a situation, right?
Yeah. And if it's a
Good.
persistent behavior, contact your family physician, call our central intake line, perhaps. If there's anything, we do have some group programs and individual therapy that we have available.
Yeah,
Well,
early intervention, early intervention,
yes.
early identification, early intervention for these kids is so crucial so they don't have issues later in life. Because then that's going to be like a lot of issues that come in contact with the law, drug use, stealing, and that's because we wanted to intervene now if a kid is like suffering from ADHD or any other disorder.
Yeah. Yeah. And you're not alone. A lot of children do steal in life, unfortunately.
Yeah.
But this brings us to the end of our session and our time together tonight. Thank you to our presenters. We do have a poll if you haven't filled it out sooner. But thank you for joining us. We hope that you found the information this evening helpful. Thank you for all your questions. And again, your feedback is very important to us. Your feedback will really help inform us on how we're doing with our sessions. And stay tuned to the CANARC website. We have another session coming in April that currently is being scheduled as recognizing mental health in children 0 to 6. So we're going to address some of our younger children. But thank you, everyone, for participating and joining us. I hope you all stay safe and don't have to go shovel your driveways when you log off. But have a good evening. Thank you.
Bye.
Bye-bye.